So guys, look at this question asked here in the recent MBBS medicine exam. What are the types of psoriasis? Okay, so they are asking about what? Psoriasis. So it's dermatology topic, you can say. Psoriasis, they are asking types and discuss systemic therapy of psoriasis. So they are asking two things here, the types of psoriasis and the systemic therapy. They are not asking topical, systemic therapy they are asking, guys. So this is for 5 marks. So let us say, let's get started with the types of psoriasis. So tell me the types of psoriasis means immediately you will tell this, okay? Don't say what psoriasis is and histology and all. Plaque psoriasis, guttate psoriasis, erythrodermic psoriasis, pustular psoriasis, and arthropathy. Okay, can you see this? Plaque psoriasis, guttate psoriasis, erythrodermic psoriasis, pustular psoriasis, and arthropathy. Okay, now in this, now you'll start explaining plaque psoriasis. Okay, so look at this one here, this image here, taken from Davidson textbook. Plaque psoriasis. So this is happening in adults. You can say most common and stable disease it is. Here in extensor surfaces, you will see it will affect nail, scalp, everything. You can say extensor surfaces. Don't forget to write this word. Then there is silver to white scales, right? And then when you scrape the surface, you will have bleeding spots, Auspit sign. This much you will write. Okay. Next. You got it, guys? Okay, next let's go to guttate psoriasis. So now guttate psoriasis, you're seeing here, this is guttate psoriasis. So basically it happens in children and adolescents. Later in life, they will get the standard adult psoriasis. So this is happens post-strep, okay, post-streptococcal infection. Individual lesions are droplet shaped, small, usually less than 1 centimeter in diameter, erythematous, scaly and numerous, okay. So there's nothing much serious about this guttate one. Individual lesions, you saw very small, etc., etc. Adolescent, child, post-strep. Okay, what else? Erythematous, scaly, numerous. Scaly, you can write everywhere. Okay. Droplet shaped, if you want, you can remember. Guttate. Okay. So now you're done with plaque psoriasis, in which you saw nail involvement, scalp involvement, and all will be there. Then you saw what? Guttate psoriasis. Right, now we will move to the third one given by the textbook. Okay, that is this one, erythrodermic psoriasis. This is a medical emergency. They are saying erythrodermic psoriasis. Let's move to this one. Okay, so they are saying it is a medical emergency. Generalized erythrodermic psoriasis is a medical emergency. They are saying this this one, erythrodermic psoriasis. See, I'm telling you, they did not give anything more about this condition in the textbook, Davidson. So this is erythrodermic psoriasis. You can write that this is medical emergency. Okay. Generalized erythrodermic psoriasis as medical emergency. Okay. Now let us go to the fourth one, pustular psoriasis. This is also important. This is life-threatening. Especially if it is generalized, it is life-threatening. So this, in this you will remember that is life-threatening. It can be localized or generalized, and if it is generalized, then it is uncommon, unstable, and life-threatening. Okay, and what you should say, patient can have fever, etc. Then it's kind of spreading everywhere, some wave or sheet kind of formation on the skin. Then it can happen as rebound okay, this is not that every time, but the saying can be rebound phenomena for glucocorticoid. So it can be topical or systemic, they are saying. Okay, so this is pustular psoriasis. We are done with this. Now let's move on to the next last one, that is which one, guys? Arthropathy. You already guessed, arthropathy means joints are involved. Okay, so we will say psoriatic arthritis. Okay, so this is the image that the textbook gives. So basically what they are saying here is that this can be symmetric or asymmetric. There can be psoriatic spondylitis, distal intraphalangeal joint arthritis can be there. Then there can be nail changes, right? Nail changes. Very importantly, they are talking about nail changes, guys. They're talking about what? Nail changes. Okay. Then there are many terminologies. If this psoriatic arthritis itself, you can write one textbook like that. And they're saying this is more like a clinical diagnosis, okay? Not a lab diagnosis for this. So let's stop here for the first part of the question. That is the types of psoriasis we have finished. Okay, next they ask the systemic therapy. Now systemic therapy, let us look at. So guys, to understand the systemic therapy, you need to understand why, right, what exactly it is. So psoriasis, basically you can see this is normal skin and this is psoriatic skin. In this you can see that there is hyperkeratosis. The keratinocytes are more, right, they're differentiating more, they still retaining nucleus, etc. Very thick epidermis is there, right, and there is one lot of tortuous blood vessels here you can see, right. So what happens when you remove these scales, at that time they will bleed, and that is called as Auspitz sign, right, the bleeding spots, because of this tortuous capillary loop. So basically this is an inflammation also is there here. So what and all you'll write here, hyperkeratosis, then this vascular loops are tortuous, right, and then you will say there is inflammation. So these are the histology. Okay, so now based on this you will give the therapy. But what will you start with? You will start with topical vitamin D analogs, emollients, retinoids, glucocorticoids, etc. Okay. Then you will give them phototherapy, like that is UVB, narrowband, or you can give them PUVA, right? UV again, UVA, UVB. That's what they're talking about, phototherapy. Okay. Did you understand so much? Okay. Now let us go on to systemic therapy. In systemic agents, you have to write these: methotrexate, cyclosporin, acitretin. Okay. Then I'll give you all the names. What is very important: methotrexate, cyclosporin, acitretin. It is very similar to your rheumatoid drugs, right? Anti-rheumatoid drugs. Then you will add, you can consider apremilast. What is this? Apremilast. For resistant disease, they're talking about biologics. Okay, for resistant disease. So you can see here, all these are like monoclonal antibodies, right? MAB. Ending MAB means monoclonal antibodies. So here you have anti-TNF alpha and anti-interleukins on this side. Most of them are ending as MAB. Okay, that's what I want you to focus on. And here only one thing is not ending as MAB is etanercept. Okay. So anti-TNF alpha, adalimumab, etanercept, infliximab, anti-interleukin ustekinumab, then guselkumab, okay, and then all these another two crazy names here, ixekizumab, secukinumab, okay. So these maps you have to try to remember and write in the exam. So this is the systemic therapy, guys. Now let us try to place these in the pharmacology textbook. So if you look at the pharmacology classification for drugs for psoriasis, you have topical steroids, topical calcipotriol, that is vitamin D, right? Then tazorotine, this is a retinoid, topical again. Then they're talking about coal tar, topical, but this is what they have not asked in the exam. What they have asked in the exam is systemic therapy. In systemic therapy, acitretin, methotrexate, etanercept. Okay, this is what pharmacology says. I think this is better. You please try to spot them here. Cyclosporin is here, right? Cyclosporin, methotrexate, cyclosporin. Then what is that? The other one we saw with A, right? Okay, acitretin. So we have tried to spot this in immunosuppressant drugs. Then you have the apremilast. Let's see if this is there. Not exactly, I can't find this apremilast. Now let's move on to the last section that we want to spot in pharmacology textbook. Adalimumab, etanercept, infliximab, ustekinumab, guselkumab, ixekizumab, and secukinumab. Okay, let's try to spot these. So in biologic agents, you can see here under immunosuppressant drugs, right? Under immune suppressant drugs, you have the biologic agents under which you have the TNF alpha inhibitors, etanercept, infliximab, adalimumab. Then you have the interleukin drugs. Okay, interleukin. What is that? Anti-interleukins. I don't see this there. Just remember ustekinumab, guselkumab, ixekizumab, and secukinumab. Okay. Kizumab. Wow. Okay.